Hi, this is Debbie, and today we are going to do a narrative presentation of a head-to-toe assessment. So let's get started. I am the nurse, and I'm going to go in and introduce myself to my patient and tell her the purpose of my visit today. I will then go ahead and ask the patient for her name and her date of birth, assess her level of orientation and her level of alertness, and I will then gather my equipment and wash and sanitize my hands. My assessment will begin first with obtaining the patient's vital signs, which will consist of temperature, pulse, respiration, and blood pressure, and end with an assessment of pain. We're going to then move on and assess the head, neck, and face, looking at the external structures first for any type of abnormalities such as lesions, wounds, swelling, inflammation, infestations. We're going to then take a look at the carotid and the temporal arteries, which are located. The carotids are on the lateral side of the neck. The temporal arteries are at each temple, and we're going to assess the characteristics and document those characteristics on a scale of 0 to 4. We're going to then look for symptoms of TMJ. The nurse will palpate the temporomandibular joint for any signs of crepitus or grating by asking the patient to open and close their jaw several times. We're going to then take a look at the thyroid gland, which is located on each side. There's 2 lobes on each side of the trachea. Ask the patient to raise their head, and you'll palpate each side of the trachea for signs of tenderness, pain, or enlargement. And you want to make sure that the trachea is midline. We're going to then take a look at cranial nerve 5, which is the trigeminal nerve, and assess that by asking the patient to tightly clench their jaw and their teeth, looking for contraction of the masseter muscle. And we're also going to do a wisp test, which will check for corneal reflex by touching a small piece of cotton to the cornea lightly. And what you should see is bilateral blinking. Cranial nerve 7, the facial nerve, can be assessed by asking the patient to frown, smile, raise their eyebrows, or puff out their cheeks. Cranial nerve 12, the hypoglossal nerve, can be assessed by asking the patient to say light, tight, or dynamite, and looking for signs of dysarthria, evidenced by slow or slurred speech. At this point, you'll look at the cervical lymphatics, beginning at the preauricular area and ending at the supraclavicular area. There are 10 cervical lymphatics in the face and neck, which the nurse will palpate for tenderness, masses, or discomfort or pain. The skin can be inspected next. The skin, you're going to look at temperature, color, and moisture. The skin, the color should be obviously pink and normal for ethnicity. The temperature should be warm and dry. There should be no bluish or duskiness to the skin. And turgor can be assessed by gently pinching the skin of the upper hand and seeing it resolve. That would indicate the level of hydration status. Capillary refill is next. You can check capillary refill by depressing the fingernail on the hand and the toes until it blanches, and then release the pressure and wait for that pinkish color to return in about 2 to 3 seconds. You're going to then take a look at edema, especially of the lower extremities, by visually looking at the lower leg and palpating with 2 hands, putting pressure in the tissue and looking for indentation. And you will note that as pitting and grade that on a scale of 0 to 4, which indicates the amount of time and depth that it takes the pitting to resolve. We're going to move on to the eyes and look at the external structures of the eyes. We're going to make sure that they're symmetrical, that there's no inflammation, there's no lesions, there's no drainage. Then we're going to move on to assess the cranial nerves that innervate the eye and the eyes, basically. We're going to look at cranial nerve number 3, the oculomotor nerve, and we're going to assess that by doing a field test, asking the patient to look at the 6 cardinal fields of gaze, having them follow an object. You're going to have it move from midline to the far right, upper right, lower right, back to midline, far left, upper left, and lower left. We're going to then assess peripheral vision doing the confrontation test, which requires the nurse and the patient to stand about an arm's length apart. Each will cover the opposite eye, and the nurse will then place 2 fingers up in the field of vision at the upper and lower field of vision on each side and ask the patient to identify the number of fingers that are that are elevated. The corneal light reflex test requires the nurse to dim the lights to allow the pupils to dilate. The nurse will then take her pen light and ask the patient to hold their head still, coming in from the side on each eye, looking for pupillary constriction. If all of these tests are normal, then you will chart Perla. Moving on to the ears visually external structures of the ears need to be looked at again for swelling, lesions, any type of wounds, pressure areas if the patient's bedbound, and possibly tophi, which are little uric acid crystals on the outside of the ear. You're going to want to take a otoscope and look at the internal structures, focusing on the tympanic membrane, which should be shiny, pearly, and translucent and intact. Moving on to the mouth and throat, you're going to want to use a tongue blade and a pen light and gloves at this point. But prior to inspecting the mouth, you're going to want to test the maxillary and the facial sinuses, the frontal sinuses, for any type of discomfort by gently applying pressure. The patient should feel slight pressure but no pain. You're going to go ahead and look at the external structures of the nose and the mouth to make sure that there are no deviations and abnormalities there. And then go ahead and look at the internal oral cavity for the gums. You're going to look at the teeth for any cracked or broken teeth. You're going to look at the hard and the soft palate. You want to look underneath the tongue for any evidence of cancer that usually tends to start there. And then assess the uvula. Make sure the uvula is midline and it elevates when the patient says ah. That will show an intact cranial nerve 9, which is the glossopharyngeal. Moving on to assess the chest, the nurse is going to want to assess for normal and abnormal breath sounds anteriorly and posteriorly using the diaphragm of the stethoscope. You're going to assess from the apex to the base of the lung anteriorly and posteriorly. You're going to want to look for adventitious breath sounds, which could indicate pathology or disease, such as Rales, rhonchi, wheezing, or stridor. The nurse will then check for any tenderness or masses on the chest anteriorly and posteriorly by just gentle palpation of the skin, focusing on the costovertebral angle. And what that means is on the lateral aspect of the spine, the nurse will just gently go down the spine and test for tenderness. The nurse is also going to want to test for tactile fremitus, which is a vibratory tremor that should be heard when a patient says the word 99 or blue moon. It is normal to hear over the mainstem bronchus in the right and between the scapula in the back. The nurse will then check the heart sounds, and what you're going to do is listen for S1 through S4 at the point of maximal impulse, which is the mitral valve, and then listen at the aortic, the pulmonic, the tricuspid, and the mitral valve with the bell of your stethoscope for any type of a systolic murmur, which would be graded 1 through 6. The nurse is then going to move on to assess the abdomen with the patient laying supine. You're going to note what the contour and shape of the abdomen looks like and describe it as round, flat, or scaphoid. You're going to observe the abdomen for any type of pulsatile movement, which would typically come from the aorta right below the xiphoid process. You're going to then move on to auscultate bowel sounds beginning in the right lower quadrant, moving clockwise. You should hear 5 to 30 bowel sounds per minute in each quadrant. Then the nurse will go ahead and palpate the abdomen for any tenderness or masses with light and then deep palpation. The patient should not feel any pain when this is being done. Light palpation is about 2 millimeters and deep is going down about 4 millimeters. Moving on to the extremities, you're going to want to assess for a range of motion and strength in the extremities. And in all of the joints of the upper and lower body. You're going to support the joints as you range them through their full range of movement, and if there's any pain or resistance, you're going to want to stop. Looking at range of motion against resistance, you can have the patient do a grip test by having them squeeze your hands as tightly as possible. Shrugging their shoulders against resistance will show strength in the shoulder area. You want to assess the range of motion in the head and neck by having the patient move their head around and up and down and side to side. You're also going to want to make sure that the pulses of the upper extremities are intact. Lastly, you're going to take a look at the neurologic system, and you're going to want to test for balance and proprioception, which is their sense of where they are in space. So the balance can be assessed by having a patient walk in their bare feet, heel to toe, and watching them walk in a straight line without losing their balance. The nurse will then perform the Romberg test, which is asking the patient to put their feet tightly together, closing their eyes, and seeing if they demonstrate any sign of ataxia. You want to stand close to your patient in case they start to deviate. You're going to then test the deep tendon reflexes. The brachioradialis reflex can be assessed by locating the brachioradialis tendon in the forearm, which is about 2 to 3 centimeters above the styloid process. Locate the tendon with your reflex hammer, gently tap the tendon briskly with the hammer. You should see the biceps flex and you should see the hands supinate. That would be a normal response. You're going to want to then move on to the patellar reflex. So you're going to extend the patient's knee out. The patellar tendon is right below the kneecap. You want to relax the knee, support the knee with your hand, and then tap it, and you should see the leg extend outward. That is a normal response. And lastly, you want to do a rapid alternating movement test to test cerebellar function. And what that is you ask your patients to hold their hands out straight and ask them to flip them up and down, up and over as rapidly as they can. And you watch for sequencing, bilateral sequencing, or you can have the patient touch their fingers to their thumbs and see if its bilateral sequencing is appropriate. And last but not least, you're going to ask your patient to do some logical flow and sequencing. You can give them a list of 3 to 5 words and ask them to repeat them back in the same sequence that you repeated that to the patient. This concludes the narrative presentation of my head-to-toe assessment. I hope everyone enjoyed that today. Thank you very much and have a great afternoon.